Kia ora koutou katoa, he mihi mahana ki a koutou, ko wai ahau, ko Segina Te Ahuahu tōku ingoa, he uri no te tai toke rau, ahau. Ai, nō reira tēnā koutou katoa. So, kia ora everybody, my name is Segina Te Ahuahu, and my role actually, I work within the District Health Board as the Portfolio Manager for Mental Health and Addictions. And thank you to Moi. Thank you for inviting me to be part of the panel this afternoon. I had hoped to come along and just be here, to be present, to listen to the whakaaro or the voices of the community. Before, I suppose, I talk about the question on the table around decriminalisation, I suppose I wanted to talk a little bit about myself for a moment. So I have a real passion for work in this area. So I've recently come to the District Health Board after spending probably the last 13 to 15 years working in the mental health and addictions field as a practitioner for both the District Health Board and actually for a kaupapa Māori organisation, Ngāti Hine Health Trust, managing and leading their mental health and addiction services for the last 8 years prior to taking on board this role. So I suppose what I bring is a in-depth, I suppose, a working knowledge of what the real challenges are when you're working in the addiction space. I've been involved with the delivery of mental health and addiction services with children and youth, with adults, and also residential rehabilitation. So, and that's grown. So I've came into this mahi, I suppose, because like lots of other Māori in particular, I have a whānau, and within my own whakapapa, there's been a really strong history of alcohol and drug abuse, of mental health and addiction issues. So, while I may sit in this particular role, first and foremost, I am a person, I am of Māori descent, and so I intimately understand the challenges of dealing with alcohol and drug abuse after having experienced that within my own whānau as well. So I suppose I have come today, with a view, so I've been lucky, I suppose, in the journey that I've had so far, that I've had the opportunity to, I suppose, join the District Health Board and come on board in order to do something, to give something back, to actually be a part of influencing the way forward so that we actually do try to better meet the needs of our community and our whānau out there. And so that's something, I suppose, that I bring and continue to be really passionate about in my current role. So in terms of decriminalising, I think, as I've said, I come from a practitioner background as well. And so I am a big proponent in terms of evidence-based approaches. I certainly acknowledge, the kōrero you've got. There's a lot of models that are out there in the international forum, that point to really good evidence around, the possibilities of decriminalising, decriminalising some drugs. So I think, and as you said, Holland is a great example, and there are several others that are out there across the country and across the world that I think are worth merit, that are worth looking at, because they have merit. On the flip side, I suppose, again, from a practitioner background, I think, I've been lucky because I'm affiliated with DAPANS and gone to several conferences as well, to have had feedback from places like Bali. Bali's the other end of the continuum, where there's no tolerance at all for drug use, and so they, I think here within Aotearoa, although we may still, we've got a system that still criminalises drug use, at the other extreme, where they're not, in Bali, places like that, it's completely illegal and they have zero tolerance, and so people are going underground. People are literally going underground to try and seek support, for their actual drug use. So I think the fact that we do have services that are available, that are trying really hard to be responsive to the community, and we've got, so we're lucky in the sense that we do have some infrastructure that supports health-based approaches, to dealing with the issues of drug and alcohol abuse. So I suppose, I think, in summary for me, I suppose, I think, that evidence-based approaches provide a really good way forward, but I also agree with the kōrero from Tuari, in that I think, we've got bigger issues. There's issues of poverty and deprivation, and and like you were saying, is actually, it's really hard. You need to offer people other alternatives, and for lots of the whānau here, they think that drug dealing and being a meth cook is the only way that they can support their whānau in a meaningful way. So I think, looking at other ways to actually, replace, and offer people real options forward are really important. And I suppose one last thought for me is the importance of community and whānau. We all have to do, we all have to be assertive and take action, and we can start within our own whānaus, within our own homes, and then we can look at what we can do for the broader community. So, kia ora koutou katoa.